2-576-1117. Let me repeat those dates, either on February the 24th or between February the 28th and March the 3rd. Again, DC Health recommends that those people visiting the church self-quarantine for 14 days from the last time they visited the church. Congregants who do not have symptoms but have questions can also email DC Health at coronavirus@dc.gov. As of this morning, patient 1 remains hospitalized. The second confirmed case involves an individual who traveled to the United States on Saturday, March 8th. DC Health was notified by the state of Maryland of an individual who stayed in Washington, D.C. before presenting himself to a Maryland hospital for care. There, he tested positive for COVID-19. Because the individual, known as Patient 2, stayed in D.C. for one night when he arrived in the country, the CDC classifies this case as a D.C. case. D.C. Health is also conducting contact tracing of Patient 2. Based on DC Health's investigation, 3 individuals who stayed in the same residence as Patient 2 were tested for COVID-19 on Sunday, and all 3 tests yielded negative results. Of these close contacts who tested negative is a staff member at the School Without Walls. This staff member continues to be asymptomatic and is now following the CDC self-quarantine protocol. This means that there is no immediate risk to staff or students. To give the school's administration adequate time to communicate with staff and families, School Without Walls is closed today. Out of an abundance of caution, we also deep clean the school, or will deep clean the school for students and staff to return to class tomorrow. As of this morning, Patient 2 remains hospitalized. And that is where we are as of this morning. As we know, this is a fluid situation. Our teams are planning continuously to make sure that we are serving D.C. residents, keeping D.C. residents safe, and following the science. I want to add that we continue to ask residents to stay at home if they're sick, to call ahead to a healthcare provider if they develop symptoms of COVID-19, which include fever, cough, and shortness of breath. And with that, we will take your questions. Yes, sir.
Mayor Besser, is your expectation, the professional's expectation, that this thing is just going to mushroom? Like already 2 other schools have announced they're closed today. So any of these contacts for people, several hundred people probably went to Christ Church on those days, and if they're supposed to self-quarantine, this thing is just going to keep spreading quick in large ways.
Well, we see what's happening across the country, and certainly we want to put our city in the best position to respond and to care for people who have been exposed, and to make the best decisions we can for our students and staff and all the staff of DC government. Yes.
Mayor Brown, I was just kind of curious in terms of the recommendation, self-quarantine. Is it a CDC recommendation, or is it a Department of Health's recommendation?
To self-quarantine for the members of Christ Church. Let me turn to our doctors at DC Health, Dr. Todd Walker.
So it is a DC Health recommendation that is consistent and grounded in the science of the CDC. So there are very clear guidelines during disease transmissions when we are trying to control the spread of disease about what we should do to manage risk of exposure. Throughout the contact investigation, when we are identifying people and places who are exposed to positive cases, we collect information to get a sense of what that exposure risk is really like. So throughout our investigation, we determined a certain level of risk for these contacts of our case, which is medium risk. And there are very clear guidelines as to what the strategies for managing that risk are for that category of a risk. So that is what we're following. That is the instruction that was given to the church members.
Can we clarify, is that anyone who visited the church, whether they're feeling ill or fine, anyone should self-quarantine for 2 weeks?
For those dates, yes. So that is when we have identified the February 24th, February 28th to March 3rd. That is when our case was symptomatic. So anybody who was potentially exposed during that time, out of caution and best practices for disease control, that's the recommendation.
Do you have any idea how many people that might be?
So where are you coming from? Sorry.
Do you have any idea how many people that might be?
So several hundred people were potentially impacted, had interactions with the positive case during those dates.
Can you tell us what kind of interactions? Was he giving out communion? Did he have direct contact, physical contact with the parishioners?
So the definition for close contact, which is what I would provide as opposed to the specifics of the actual case, when we talk about close contacts, it is a person who is within 6 feet of a positive case who is having symptoms, and that usually includes also interacting with that person, but that's the CDC definition, is really within 6 feet. It also could mean close contact with a secretion of a positive case, again, who is symptomatic. The other category that's medium risk that we're not, that's not really applicable here, are people who live with the positive case while they're symptomatic, but they're able to be in a separate bedroom, use a separate bathroom, potentially have protective gear in their interactions. So all of those kinds of contacts are considered medium risk and would follow this guideline.
Did this minister give out communion while he was infected?
So we wouldn't give out the actual specifics of the case. But based on our investigation and what we've identified as the exposures, we're categorizing it as medium risk and following the standard protocols for that.
Can I follow up on the patient or the woman we know as Maggie from social media? When I asked you this question on Saturday, you said that the reason she wasn't tested is she didn't meet all the CDC protocols. She had just been in an airport, and that she was getting better. Right after that, her family took to social media to dispute that, what you said Saturday, and the fact that she was not getting better. I'm just wondering if, once again, you could address that.
Sure. So we have been in contact with the patient. We have been in contact with the provider. So we have made a decision and a determination based on the factors presented to us to test the case. And that's all the information that I'd want to give on any particular individual.
Has she been tested now?
Yes.
She has been tested and is awaiting the results?
The sample will be delivered to the lab, and then the results will be out after that.
You know, I'm curious as to wonder if you think this is a time where there is to declare a state of emergency. You're recommending 700 people in the church self-quarantine. Few schools have closed as some precaution. And with the statement, you declare a state of emergency, and also to the status of the Cherry Blossom Festival.
I am evaluating if I need an additional power that I could achieve through a public health emergency, and that would be to impose quarantine if that became necessary. And we have 2 positive cases, both hospitalized, and if they are discharged from the hospital where they still need to be quarantined, I would need that power. So I'm doing that legal review. I'll brief the council, and I will make that decision probably later today. Yes.
Mayor, you mentioned in previous that your unique situation and powers that a state of emergency might be less necessary than another mayor of another city due to the unique structure.
Or governor. Yeah.
Can you walk me through?
Sure, and I'll turn to Chris Rodriguez to talk in some specifics. But sometimes a state of emergency will allow the chief executive to impose some actions on lower municipalities. We don't have that issue. But what the state of emergency will allow us through a public health emergency is the big critical thing here is to impose quarantine if that became necessary. All of the cases and all of the situations we've been talking about today involve self-quarantine. So it's a recommendation from DOH that we expect people to follow. More than that, let me have Chris, where's Chris, come to talk about the situations of price gouging. I could also, with an emergency, require closings in that case. So let me ask Chris to talk about it.
So, Chris Rodriguez, Director of D.C. Homeland Security and Emergency Management Agency. So as the mayor said, a declaration of a public emergency would give her expanded powers, and there's a long list of them, but some of the more significant ones, as the mayor mentioned, is to